Hello, welcome back. Today we're going to be learning about bed making. And as we all know, we make beds in our houses. In the hospital, bed making is quite different. Bed making is the act of arranging a patient's bed based on their conditions, using bed accessories, the likes of pillows and bed linens and other requirements to meet the needs of the patient, make them comfortable and make sure that they are safe. So that's the definition of bed making. We also have objectives of this bed making, which are basically reasons why we make beds for our patients. One of the reasons is to provide physical and psychological comfort for the patient. Two is to establish effective nurse-patient relationship. Number three is to engage the patient in active and passive exercises. Sometimes during the process of bed making, some of our patients might decide to walk around, or during occupied bed, when the patient cannot leave the bed, you might need to move the patient from one position to another. And through this, you put the patient into passive exercises. Another reason is to reduce the risk of infection for that patient, also to prevent pressure ulcers. In addition, you have to promote personal hygiene. You also have to identify body changes on time and prevent complications. And lastly, you have to give the ward a very neat appearance. Alright, so that will be it for the objectives. Then we go over to the principles of bed making. These are rules that guide the procedure of bed making. These are things that you are expected to do in order to make the patient safe and also to make yourself as the nurse safe. So one of the principles, or the most important principle, is making sure that you're working in harmony. Washing your hands before and after the procedure. Making sure that every conversation that goes on during this bed making must include the patient. Example, in occupied beds where patients are unable to leave their beds. And also another principle we have is do not let the linens touch your uniform, whether neat or dirty. And no dirty or used linen should be dropped on the floor. Every dirty linen that has been removed from the bed should be dropped directly into the hamper. Also, avoid creases on the bed to prevent pressure ulcer. The principles of bed making, they are very much, or they are, but I think we should stop at this and go back to the next, which are the types of bed making. We have two types of beds in nursing. We have the simple and the special beds. We have the simple and special beds. So today we are going to be looking at the simple beds, but before that, let's explain what those simple beds are. Simple beds are beds that don't need extra requirements to make them. And under simple bed, we have the unoccupied and the occupied bed. The unoccupied bed is a bed that has no patient on it, while the occupied is the one that is being retained for a patient, or the patient is actively staying on it. What we mean by retained for the patient is, let's say you come to make a bed for a patient, and the patient is an ambulatory patient. The patient can move from their bed. You can ask them to sit if they would like. So they prefer to sit. Some of them would like to walk around with this opportunity. So that bed, whatever bed you have to make for that patient, is still an occupied bed. On the other hand, we have the ones where the patient cannot leave the bed, and then you have to make it while they are there. So those ones still are called occupied beds. And you say the unoccupied is one that has no patient on it. So moving on to the special beds. The special beds are the beds that need extra requirements. Just for example, we have the bed cradle, we have overbed tables, and the rest of them to make them. And under the special beds, we have the likes of emergency beds, we have cardiac bed, we have post-operative beds, we have amputation bed, we have a fracture bed, and so on and so forth. So that will be it for the introduction to bed making. So let's go over to the procedure of making simple beds. First, we are going to take the unoccupied bed. To make an unoccupied bed, we need to gather our requirements. And here are some of the requirements needed for making an unoccupied bed. First, we have the hamper, which is the instrument used to put in soil linens. And then secondly, we have our long marking torch, which is the first thing you put on your bed. Next, we have the bottom sheet, the drawer marking torch, the drawer sheet, the pillowcase, then the top sheet, the blanket, and lastly we have the counter pillow. Also on the bottom shelf we have a pillow as well as our gloves and a sanitizer which we are using in place of hand washing. Alright, now we're about to start, so I'm going to call for an assistant to help me in making this bed. So now the first thing we have to do is to gather these requirements and make them accessible to the leading nurse, which is me, because I'm the one teaching. Now that I've gotten my requirements close to the bed, I'm going to ensure that my bed is properly locked to avoid unnecessary movements during the bed making. So I'll move to the other side of the bed and make sure that it's locked. So now my bed is steady. The next thing we have to do is to wash our hands and put on our gloves. Alright, we are all set for the bed making. So now, we're going to strip the bed of dirty linens or old linens, if any. Alright, so we're going to start from here. So always remember to observe the principles of bed making.
During the course of any type of bed making, if there is need for you to change your gloves, maybe after you must have touched a soiled linen, or maybe your gloves get torn during the process of bed making, make sure to pause and change your gloves, as safety is one of the most important things to consider.
So we talked about ensuring harmony during this. So make sure that your dirty linens enter directly into the hamper. And we talked about maintaining harmony during your bed making. So as the leading nurse, I should really want to bring in requirements and take them out as well. The next thing we have to do is to put on a long marking touch on the bed. But since our bed is already marking touched and there is no need for us to turn the bed or dust it, so we will skip the marking touch and go over to the bottom sheet. So placing the bottom sheet, you have to make sure that the rough end faces downwards, and this is the rough end.
The reason for keeping the smooth end upwards is because the patient's skin comes in contact with this bed sheet, and this will help to prevent allergic reactions and discomfort for the patient.
Make sure that there is even distribution of the sheets across the bed on both sides. And then next we are going to go on to making the envelope corner. Envelope corners are the most challenging part of making beds for beginners too. So we are going to go ahead and do that. Alright, now pull the tip of your bed sheet. Now put your hands under your hamper and lift it. Tighten the head of the bed. Now open the excess out. Alright, and we go over to the side to make another envelope corner. See? There I go. Now, tighten it as much as you can. Yeah, talking. Good. Then, here you have the envelope corner.
From here, the next thing we do is to tuck in the bed sheet, gently minding your fingers, as some beds might have springs that could injure you. If you happen to find it difficult making envelope corners, you can watch the video on how to make envelope corners on my page.
On to the next is the drawer marking torch.
The drawer marking torch is a bed sheet that prevents the bottom sheet and the mattress from getting soiled direct.
Drawer marking torch is placed in the center of the bed. Then tuck it. Let's always make sure that there is even distribution of the sheets Next is the draw sheet. You have to make sure that the rough edge is facing downward because the patient has to lie on this part of the bed.
The draw sheet keeps the patient from lying directly on the Macintosh, which would cause pressure sores due to excessive friction.
Okay. Now this is called the foundation bed because every other bed has to reach this level before you can continue. Foundation bed does not have pillow. I think there is misconception among students about foundation bed. The foundation bed has no pillow. So this is our foundation bed. Now we go on to the next. From here you can choose to add a pillow or continue with your top sheets. I like to continue with my top sheets because it's easier and neater. Alright. So for the top sheets, you have to make sure that the rough side is facing upwards. Because the patient lies in between the foundation bed and the top sheet. And this part, which is the smooth side, is the part that comes in contact with the patient's skin. Some of the reasons why we do this is to prevent irritation from patients or allergies. There is even distribution of the sheets, and then you go over to add the blanket. This blanket is actually optional, that's depending on the weather and also your patient's choice. So you're going to add the blanket. So the blanket is being added 6 inches below the top sheet. Alright, 6 inches below the top sheet. Some people might prefer to hold this part a little bit. So now we're going to hold the top sheet over the blanket, and then we can make a cup. This is the cup. Now we can make a cup. Alright, from here we'll tuck in the part that faces the door, that which is this part of the bed. So you're going to tuck in the inside, make every corner by one. Just make every corner. From here, I'm going to make an angle 45 degree. So the reason for this, this is also what we call a fan fold. So this fan fold enables the patient to enter easily into the bed when they come in. So as my patient is being admitted now, he or she, when I remove the counterpin, sits here, and then I can also extend this fan fold. The patient puts in their legs and then are being covered by this. So I have to this, and then I can tuck in the rest of the bed sheets. Alright, now I can add the key and the pillowcase. So we're going to put it together. You have to turn this open end of the pillow doesn't face towards the bed, so that it faces away from the floor. So now, the last thing we have to do is to cover the whole bed with our counter pillow. So if there are excesses on the counter, you can tuck in only the end, that's the head and the bottom part of the bed. This is where you tuck in. Every other part is left. And the reason for adding the counterpane is to protect the bed from dust and also to give the walls a uniform appearance. Sometimes most walls use one particular type of counterpane to cover their bed. So this is the end of our bed making. So we'll go ahead to remove our gloves, put it in the dustbin, and then we can wash our hands.
And don't forget to tidy your environment.